2 months ago, you couldn't open the newspaper or flip on the TV without hearing about heroin. The overdose of actor Philip Seymour Hoffman in February sparked a national conversation about opiate addiction. And while the anniversary of the Boston Marathon bombings is now dominating the news, there's an interesting legal battle playing out that's still making headlines. Governor Patrick has banned the powerful painkiller Zohydro from being prescribed in Massachusetts. It's the first time a state has blocked an FDA-approved drug, and the manufacturer is fighting back. A federal judge heard arguments from the Attorney General's office and from drug maker Zogenix today, but has not yet issued a ruling. I'm joined now by Cheryl Bartlett. She's Commissioner of the Department of Public Health and a registered nurse. Welcome to Greater Boston.
Thank you.
Well, Commissioner, why does the state feel Zohydro poses a greater threat than other prescription painkillers? That's the question.
Well, first, it's in a non-abuse deterrent form, and it's extended release. And so if it's crushed and snorted or injected, you get actually a 12-hour dose in one bolus. And so that's pretty dangerous for overdose and death. The packet insert actually gives that as a warning. And so we felt that in that form that it really shouldn't come onto the market and be a new drug that we had to deal with. We're really dealing with a prescription opiate overdose problem across the nation and here in Massachusetts, and trying to get a handle on that is really critical.
This sounds like a classic gateway drug, if I may use that term. Is that an accurate description?
Clearly, we're seeing that prescription opiates are a path to heroin.
And do you dispute whether there's a legitimate use for the drug?
Well, opiates are an effective pain medication, but we believe there are other opiates that are already on the market and being prescribed that we didn't need to add to the medications.
We had a conversation about Zohydro. After the FDA approved it, we spoke with Judy Foreman, author of the book A Nation in Pain, who says the focus on opiate addiction has a negative side effect.
There's 100 million people in pain in this country, in chronic pain. Not all of them need the opioids, obviously, but many do, and all the emphasis on the painkiller abuse is making it harder for the real pain patients to get the drugs they need.
So does banning Zohydro deprive or unfairly punish people who are in pain and need painkillers?
No, we have a number of opiates that are already on the market, some that are as potent or more potent than this particular drug, and so we think this doesn't deprive anyone, and we think what it does is help us address a real public health crisis.
If the makers of Zohydro, Zogenix, made the drug more resistant to abuse, would the governor lift the ban, do you think?
So we would definitely sit down and consider that. We have the authority, we believe, to ban it and then to remove the ban, and that the deterrent formulation would certainly help us reconsider our ban.
Are there any downsides to making prescription drugs more resistant to abuse?
I don't think so. I think people are fearful that there won't be enough pain medication management out there, but I think that what we're seeing is that there's more use of opiates well beyond pain management. We hear stories time and time again of someone having wisdom teeth out and having enough opiate prescription available for a year. Our feeling is if you have to take opiate medication a year after wisdom teeth removal, there's probably a problem.
I believe one of the assistant attorney generals who argued the case today at the hearing before Judge Zobel pointed out that 29 attorneys general have concurred with Massachusetts, and that the advisory board, the scientific advisory board for the FDA, decided 11-2 that it should not be approved. Is that correct?
That is correct. And so we would say that the scientific evidence isn't there that this medication was necessary to control pain.
So that's most of the states in the union. Why then can we even argue about this, or are we arguing about it?
Well, from a public health perspective, that's a very good question. I meet with my colleagues across the nation, and this is really the #1 challenge that we're talking about week after week.
All right. Commissioner Bartlett, thanks for joining us.